India is home to half of the tribal population of the world. They constitute 9% of India's total population. The tribal live in unapproachable physical areas such as deep valleys or dense forests. Tribal cling to their own customs and traditions and remain isolated from the civilized world. Melghat means cluster of ghats. This is a region situated 150 kilometers from Amravati district of Maharashtra in central India. 85% of the 300,000 population belong to Korku tribe scattered around 4,000 square kilometers in 320 villages. Most of them are small farmers or agricultural laborers living below the line of poverty. The population density here is low as 75 people per square kilometer as compared with density of 11,000 people per square kilometer in cities like Nagpur. Melghat was infamous for its very high maternal mortality, infant mortality and high rate of death of young in productive age groups 16 to 60 years.
When we started the project, the under 5 mortality rate was more than 140 per 1000 live births, which was nearly 2.5 times that of rest of India. The prevalence of severe malnutrition was more than 20%, which is again worst as compared to most of the African countries like Sudan, Ghana, etc.
The major public health issues here are malnutrition, home deliveries, communicable diseases such as tuberculosis, malaria, animal bites, sexually transmitted diseases, over-addiction to alcohol, tobacco or ganja. Some tribal groups are also at high risk for sickle cell anemia. July to October is the period of heavy rainfall in Melghat and is associated with significant rise in infections leading to deaths. Medical facilities in the tribal area of Melghat are grossly inadequate. Tribal often resort to traditional faith healers known as bhumkas or pujaris for treatment. They sometimes use cruel methods such as burning of skin with red hot iron known as dama or letting bad blood drain, which is very dangerous. Seizing the opportunity of serving the most unserved, the magical duo of doctors Kavita and Ashish Satav arrived in Melghat in one of the most backward tribal areas. Thus, Mahan took birth in 1998 for saving lives and building healthy communities.
Gandhiji always used to say that real India lives in villages and youth should go to villages to serve real India. So that I learnt when I was in 7th standard. At that time only I decided so that was the most important philosophy which I am carrying in my mind. I used to run the hospital critical care unit as well as I used to go to field. So in the midnight I used to come on sometime. I used to go there sometime walking, sometime on the bullock cart or bicycle. But that was dense forest with full of tigers. Yeah. And many times I came in the midnight, 1 to 12 in the midnight. I used to be alone on that old scooter, Bajaj scooter. And when I used to run that hospital in that hut 5 kilometers from this place, there was no electricity. I used to manage the patients' torch candles. Bear used to walk, and many times we used to sleep outside during summer season. Once a snake entered in our home. We started various programs at different stages: hospital activities, critical care unit, pediatric hospital, eye hospital, blindness control program. Along with this, we are running community health programs called as home-based child care program.
Convincing tribal people to seek modern and scientific medical facility was the most difficult task. The goodwill and trust was built step by step. From the inception, Mahan has been offering treatment and medical services at highly subsidized cost and in most cases free based on economic condition of the patient. The hospital, which began in a small hut, now has OPD, ICU, pediatric unit and eye hospital. As is the experience of most NGOs, whenever one starts doing sincere and good work, resources and support follows. The hospital, which began with basic facility, now has modern medical equipment like echo equipment, ventilators and a well-equipped ICU. Mahan has found true partners in Sri Ramesh Uncle, Nimish Bhai, Prakash Bhai Apte of Caring Friends Group, Anu Aga, MP-led Foundation, Surge, Rotary Club Nagpur, Arpan Foundation US, Mastek Foundation, Virgo Foundation, Paul Hamlin Foundation UK, University of Colorado US, Syngenta Foundation, Stitching Giron, Cordiate Netherlands, CIIMS Nagpur, and scores of individuals and professionals, which has helped in improving health of tribals of Melghat.
Like when we started, it was very difficult to convince tribal to accept facilities. When Kavita joined, they never thought that a lady doctor can treat ophthalmic cases, or even there can be separate doctor for eyes. Then as patients were not coming to hospital, then Kavita started moving to field. She visited around 300 tribal villages in Melghat and more than 100 tribal villages of Madhya Pradesh. At that time, Athang was small. My son, he was small. He was just 6 or 7 months old, and she used to carry him to various villages. She used to tie him under some tree, and then she used to screen the patients, bring them in our ambulance to hospital. There was no kitchen in the hospital, so she used to cook the food for them, feed them. For her, God was patient were God. Very interesting story how we mobilized these tribals who were reluctant for hospitalization is that there was one critical delivery in one home, and the parents were reluctant for hospital delivery. They called Kavita, as they were reluctant to call male doctor. Kavita said, I am eye surgeon, I cannot do delivery because I did it many years before. They said, no, you have to come. She said, sorry. After next 2 days they came again. They said, the head is coming out, now please come. And Kavita went with her cataract surgery instruments, and anyhow she could deliver the baby. She gave stitches with the cataract surgery instruments, and she could save the baby. And later on I realized after 4 to 5 days, one person is coming daily with cattle in the hand. I was surprised why he is coming daily. Then I inquired. I realized that mother, she could not breastfeed the baby because of lactational failure, and at that time Athang was just 6 or 7 months young, and at that time Kavita used to breastfeed Athang half of the milk, and half of the milk she used to give to that child, and she did it for 15 days and saved that life. Then I realized okay, this is the one of the way of saving lives, and then we taught this story. We called this Yashoda Mata technique, as happened in Mahabharata, and we taught it to our other village health worker. Now this is common in Melghat, and then it increased faith of tribals on us, and now they have great faith. They will go, if I am not there or Kavita is not there, they will not go to other hospital. They will wait till we come.
In order to reduce preventable blindness, Mahan team conducts regular door-to-door eye checkups. As vitamin A deficiency could lead to night blindness, anyone found with such deficiencies is given required dose of vitamin A supplement. To date, Mahan team has visited over 500 villages and examined over 150,000 villages. Mahan also conducts regular cataract and eye surgery camps, and many elderly patients avail of this benefit. A team of renowned doctors, Dr. Ajay Kulkarni, Dr. Amal Tamne, Dr. Nikhil Nagpurkar, regularly help conduct these camps.
फिर बोला तो अपन को तकलीफ था तो अपन गया, पहले कम बहुत दिखता था, चेहरा इसका चेहरा नहीं दिखता था,
वो जंगल दिख रहा है उधर,
हाँ,
दूर तक की दिख रहा है।
Great satisfaction you see in patients' eyes, you know, like that they are so happy, and you just see when a bilateral patient who is not able to see, and when he can see, so the joy, you know, it's unexplainable. The most important thing is God. I have a strong faith in God. So before starting surgery, I always pray and then start.
Mahan, with the help from very renowned doctors, Dr. Dilip Ghankari of Australia, Dr. Shailesh Nisal, Dr. Kevin, Dr. Bapat, Dr. Chandak, regularly perform rare plastic surgeries at the camps. Plastic surgeries are performed for huge post-burn contractures, oral and breast cancers, cleft lip and palates, parotid tumor, etc. Reshma, an infant orphan from village Toranwadi, had inborn cleft lip with cleft palate. Due to this, she could hardly eat and was severely malnourished. Reshma had been rescued during the free plastic surgery camp, and she leads a normal life now. Rupesh suffered from severe burns and could not make use of his hands. Post plastic surgery, he is able to hold and write with his hands and slowly learning to lead a normal life. Similarly, Sunita from Tarubanda village had severe burns during her childhood and she had no mobility in her arms. She has been rescued and one can see happiness on her face today, being free from the pain of immobility. Mahan team also conducted a rare procedure of removal of 2.5 kgs of huge goiter, giving a great physical relief to a tribal woman. Beyond a high quality medical facility, Melghat needed a solution for very high infant mortality and malnutrition. During 2004, the NMR, which stands for neonatal mortality rate, was 54 per thousand. The IMR, which stands for infant mortality rate, was 94 per thousand, and U5MR, which stands for under 5 children mortality rate, was 140 per thousand. Severe malnutrition for children below 5 years of age was 9%. Following the successful model of Dr. Abhay Bang, Mahan identified and trained tribal women who had 5 to 10 years of schooling and being mothers themselves and willing to serve the society.
We are running community health programs called as home-based child care program, where we have trained local tribal semi-literate female as village health worker, and these village health workers are treating children suffering from diarrhea, malaria, pneumonia, and the same village health worker, they are treating children suffering from severe malnutrition like severe acute malnutrition, severe underweight.
पहले मतलब लोगों को इतना जानकारी नहीं था। पहले कैसा है कि लोग 12-12 महीना 1.5 साल तक बच्चे को आहार नहीं खिलाते थे, और अभी कैसा है अपने का आरोग्य शिक्षण द्वारा उनको 6 महीने के बाद में बच्चे को क्या खिलाना चाहिए उसके बारे में उन तक मतलब घर तक उनको संदेश पहुंचाते अपन।
Mahan started producing ready-to-use therapeutic food and vitamin and mineral supplements as nutrition for severely malnourished children. This program employs tribal village women to produce and pack 9 varieties of whole and powdered therapeutic foods such as sabudana, chivda, dalia, gudpatti, chikki, and vitamin mix. These food packets are high in nutrition and are distributed to the Arogya Doot village health workers who provide them 3 to 4 times a day for 12 weeks to children in their village who suffer from severe acute malnutrition or are severely underweight. Mahan's interventions have shown compelling results. The model of village level Arogya Doot and reduction of malnutrition rates have been widely published and also got a detailed mention in a joint publication of Harvard University and UNICEF. Lakshmi, an infant born in Tarubanda village with severe malnutrition, is today a normal child, bringing a wave of hope of healthy and happy childhood. Individuals in the age group 60 to 60 years comprise of economically productive age. However, the mortality rate of this group in tribal villages is high, and village people were dying prematurely due to common illness, unhygienic practices, addiction, and lack of medical facilities. Village health workers are also trained for early identification and treatment of illness in villages to mobilize and hospitalize cases that requires urgent attention. Mahan also arranges Gram Sabhas in over 100 intervention villages for community participation. Mahan, through its mobile van and documentaries made in local language, helps in spreading awareness on wide-ranging topics such as health, nutrition, hygiene, importance of village cleaning, tree plantation, de-addiction, and also conducts games for children and street plays. Given the woefully inadequate medical and testing facilities in the rural areas, villagers were on their own in their fight against COVID. Mahan stepped up its effort in helping tribal community in coping up with COVID pandemic. Not only Mahan team reached out for distribution of ration, they also spread a lot of awareness through their Arogya Doots. When scores of doctors in big cities were away from the COVID scene, Dr. Satav was busy serving serious patients in the hospital. Dr. Satav helped in rescuing over 100 severely infected COVID patients in its ICU. Mahan was honored with COVID Relief Award by World Economic Forum, and Drs. Kavita and Ashish Satav received COVID Warrior Award from Honorable Governor of Maharashtra. In order to improve the quality of diet, which is most essential for health, Mahan is encourage and train villagers to start their own kitchen garden on small plot near their homes or on farms. Basic vegetables such as ladyfinger, chilies, tomatoes, soybeans, mushrooms, etc. are grown. This has directly helped in adding nutrition to their daily diet and have saved cost for farmers. Mahan has developed over 10,000 nutrition gardens and farms, growing nearly 345 tons of vegetables. Under the innovative Umang program, Mahan has appointed a Yuva Doot who helps villagers in seeking benefits from various government schemes. Yuva Doots also influence teenagers for de-addiction. Mahan has benefited over 10,000 tribal people by mobilizing various government schemes like Manrega, road, transport, water, electricity, public distribution system, Janani Suraksha Yojana. They also conduct yoga camps. It is an irony that farmers of Melghat experience very heavy rainfall during monsoon and severe scarcity of water in summer. To solve this problem, Mahan Trust, with the help of Dilasa and Caring Friends, developed Do model, an innovative model of water conservation that helps farming all year round. The results of this scheme are very encouraging, and water in Do does not dry up despite all other water bodies going dry. Mahan has gifted Do schemes to 3 villages who have vowed to give up social drinking and channelize their energies in progressive pursuits. Dr. Satav is closely associated with the government of Maharashtra, and due to its research advocacy and public interest litigations in Honorable High Court of Maharashtra, has been instrumental in framing 25 state government policies benefiting 1 million poor tribal people in Maharashtra. Mahan has also developed framework of counselor program. The counselors are local resources recruited at public health centers. They listen and understand patients' issues, communicate in Korku, help them in getting proper and timely medical help at public health centers. They serve as a bridge between doctors and tribal people and reduces reluctance of tribal people in seeking medical help from PHCs.
2007 के दरम्यान में लोग हॉस्पिटल में नहीं आते थे, जैसा उनके ऊपर ध्यान बरोबर नहीं दे पाते थे। आदिवासी जो लैंग्वेज है, कोरकू बोली भाषा, वो नहीं होने के वजह से उनको ऐसा लगता था कि हॉस्पिटल में अपना कोई भी नहीं है। तो फिर धीरे धीरे करके हमने जो लसीकरण कैंप हो गए, उसमें जाना, लोगों को आरोग्य शिक्षण देना, फिर जितनी योजनाएं हैं वो लोगों तक पहुंचाना, फिर उनको हॉस्पिटल की ओर लेके आना। तो जो पेशेंट आने को तैयार नहीं रहते थे, उनको घर से लेके आते थे।
Mahan also conducts several researches in his intervention area. In collaboration with University of Colorado, Mahan has taken charge of systematic data collection, the evaluation of nasal swabs from a child who succumbed to pneumonia. This project is funded by Bill and Melinda Gates Foundation. This research will bring a significant change and set pitch for global health policy on respiratory syncytial virus vaccination. Mahan undertook a challenging pilot of minimal invasive tissue sampling MITS using modified ambulance facility. The objective of this exercise is to identify more accurately the causes of stillbirths, neonatal deaths, and deaths in the age group of 1 to 60 months and 16 to 60 years. This is being conducted in 4 government and Mahan Hospital and in community covering 93 villages with population of 100,000 in Melghat over 1 year. Doctors Kavita and Ashish Satav have won several awards in recognition for their outstanding work from national and international institutes. These include Public Health Champion Award from World Health Organization, Real Global Award by Save the Children of UK, Best Research Project Award and Young Scientist Award by Indian Council of Medical Research, Doctors Award for Excellence in Social Work by Honorable Chief Minister of Maharashtra. Dr. Satav was also felicitated by the former President of India, Honorable APJ Abdul Kalam, and also by former President, Honorable Ramnath Kovind. Dr. Ashish Satav has participated in 29 international conferences, including Lenson, BMJ, and have had an honor of being a keynote speaker in a conference of Gates Foundation in UK. Research papers of Mahan have been published in 28 international medical journals. Dr. Kavita and Ashish Satav, along with Avinash Satav, Dr. Shilpa Satav, Sameer Palaskar, Manik Palaskar, Dr. Dani, Mrs. Pennikar, Dr. Shubda Kirwadkar, Tukaram Shinde, Dr. Bipin Khadse, Dr. Abhijit Bhardwaj, and dedicated staff strength of over 200 strong people are working tirelessly in revolutionizing the health scenario in the region.
Mahan Trust has benefited more than 400 villages and more than around 5 lakh people of Melghat and Madhya Pradesh, and through our advocacy with the government agency, through our research publications, benefited more than 10 lakh poor tribal people across the state of Maharashtra. I believe in Baba Amte's one sentence. Baba Amte used to say की ज्याची स्पर्धा स्वतःशी त्याला कोण जिंकणार, आणि आपल्याला आजपेक्षा उद्या आपल्याला स्वतःला चांगलं व्हायचं आहे. सो वी हॅव टू कॉम्पीट विथ अवर सेल्फ. सो वी बोथ ऑफ अस, मायसेल्फ अँड कविता, वी केप दॅट इन माइंड की वी नीड नॉट हॅव टू कॉम्पीट विथ एनीबडी एल्स. वी हॅव टू कॉम्पीट विथ अवर सेल्फ ओनली.
I just really want to convey that be honest in your work. So if you are honest enough and you want to do something for society, so it's Almighty who arranges for you everything, and you wish for good thing and you definitely get. So that positivity you should always have.
Tobacco and alcohol are the major killer of the youths. So if we can reduce smoking and tobacco and alcohol consumption, we could reduce mortality in economically productive age group, which is the most important part of any nation, family or community. So that is one. Second future plan is replication of all these successful programs: home-based childcare program, counselor program, community-based management of severe malnutrition and mortality control program throughout India and developing countries. Third is multi-speciality hospital, big, and tribal medical college. But if there will be medical college, tribal medical college, the students from tribal area will come get admissions, and again there will be bond. This is my dream. They have to serve for any tribal area for 5 to 6 years.
The sunrise of Melghat happened 25 years back. Tribal health has seen a significant upward rise. The journey seems to have just begun. These tribal have all the reasons to celebrate glorious 25 Mahan years.